Now, with the techniques we have developed, which combine both the scalpel and the catheter, we can effectively close almost all leaks. And that's how we are effective. We achieve a success rate of 70–80%, so it completely changes the data of the problem. The effectiveness we observe has been established for 5 years. I contact the patients I have operated on repeatedly over time to see how they are doing, how their erections are, which allows us to observe a real stability of the result. It is written on the internet that when you close one leak, others appear. That's not true. It's false. When you close a leak, if it doesn't work, it's because there are other leaks that we haven't closed. But if we close all the leaks, there's no magic. None reappear. Therefore, the result is stable over time. After surgery, you need to wait a month and a half to resume sexual activity and, extremely importantly, 3 months to get the true effectiveness response. Systematically. 3 months later, I have a Doppler ultrasound done. It is the examination that allows us to detect the functioning of the vessels. So, it is during the Doppler ultrasound that we have this 70–80% documented effectiveness objectively. So medical imaging has also completely changed the intervention itself. During the operation, thanks to modern equipment, we can see that this leak that existed before the operation has been properly treated and that such a leak still needs to be addressed. So this imaging gives us in real time what is happening and what we have been able to perform or what we still need to do to perfect the operation. This is very important. The second point is that now, during the same operation, we can use extremely diverse techniques. We use a scalpel to tie veins. We use microsurgery with extreme magnification to see the very small veins that we will be able to treat. We can use a catheter, that is to say a tube that we can move inside the body to reach leaks that are located very deeply and seal them with a type of biological glue that we use for this purpose. Hospitalization can be outpatient, otherwise it is 1 night of hospitalization. If we are a bit far away, for example, if we have to take a plane, a flight within the European Union, it's 5 days without flying. If it's a transatlantic flight or beyond, it's 2 weeks before flying safely. It is very important that more and more patients suffering from these severe erection problems can have information. Don't hesitate to ask questions. I always respond as quickly as possible and in a personalized manner. Thank you. And don't forget to share. Goodbye.